Something many women have not heard of that may lower the risk of ovarian cancer by 80%. Wow. 80. Rhiannon Ally is back with a story we first saw in the New York Times. Rhiannon?
Yes, Robin, 80%. Ovarian cancer is known as the silent killer because there is no reliable screening method and the symptoms can be really vague. So now doctors at some of America's top cancer hospitals are teaming up with Breakthrough Cancer to research a new prevention strategy that they say could save thousands of lives.
She was an amazing sister, wife, mom, grandmother.
Kira Wynn was a college senior when she lost her mother, Linda, to ovarian cancer.
When you see somebody go through what my mom went through, just see this disease take everything from them and in turn take everything from you. I don't want my kids to ever have to go through what my family has gone through.
Ovarian cancer impacts more than 20,000 women each year. Most cases aren't discovered until later stages after it is spread throughout the body. Only 30% of those patients are expected to survive beyond 5 years. Many women have no idea most cases of ovarian cancer actually start somewhere else.
The most common deadly type comes from the fallopian tube. Tiny cancer cells that form on the end of a fallopian tube. They slough off, sort of like dandruff does from our scalp. And so that's how this cancer spreads. It's by shedding all throughout the abdominal cavity.
Research shows women who have had their fallopian tubes removed, a procedure called salpingectomy, have an 80% lower risk of developing ovarian cancer.
The number one eligibility criteria for this intervention is that women do not need their fallopian tubes for future fertility. And that can mean that you're done having kids, you never wanted kids, you're going to adopt kids, you're going to do IVF.
The American Cancer Society and the American College of Surgeons both recommend offering patients opportunistic salpingectomy at the time of other planned procedures, such as hysterectomy, or instead of tubal ligation.
Based upon current projections, we think that if women were able to universally choose fallopian tube removal at the time of hysterectomy and as an alternative to tubal ligation, that would save almost 2,000 lives from ovarian cancer every year.
Now 37 years old with 2 children of her own, Kira recently underwent a hysterectomy along with salpingectomy, confident her mother would be cheering her on.
I will be there for my grandkids. God willing, and I know it's not going to be because ovarian cancer took me from them.
Kira told us she doesn't have any concerning gene mutations, but because of her family history with cancer, she is considered at elevated risk. That is why one of the reasons she decided to have her tubes removed. Robin, she tells us she is just relieved to have this weight off her shoulders.
Oh, bless her heart, bless her heart. Rhiannon, thank you so very much. Our chief medical correspondent, Dr. Narula, joins us now. There is so much that we could unpack with this, but let's just talk about what more should women know here?
Women need to listen to this story because unfortunately so many women and doctors don't know about this, Robin, and you and I were just talking. This has actually been recommended since the 2013-2015 and no one has talked about this. So first of all, it's important to understand what your risk is, right? So if you have a family history like here in the piece, talk to your doctor about getting genetic testing, screening, or counseling. If you are BRCA1 or 2 positive, you're actually in a different category where removal of the tubes and ovaries is recommended, both of those things, starting in your kind of after childbearing years, 30s, 40s. However, if you are not BRCA1 or 2 positive, you're kind of generally considered low or average risk, you need to listen to this, right? And this is the time where you should be thinking about, am I done with childbearing? Do I want to just be doing IVF? Do I want to adopt kids? Do I not want to have kids? That is the woman that should be considering this kind of surgery, which is just removal of the tubes to lower her risk. Now, what should she know? There's still a very small residual risk of ovarian cancer that is starting from the ovaries, not the tubes, but it's only about 10%. And as you heard in the piece, to drop your risk of cancer 80%, a cancer where majority of women have no risk factors, we have no screening tools available. When it's diagnosed, it's usually metastatic and the survival is about 5 years. That is huge. Second thing to know is that if you do want to get pregnant, you have a uterus, you can still do that with IVF. And the third thing is, this is something to be having a conversation with your doctor about if you're going in for a routine pelvic or GYN surgery, like, for example, having your tubes tied. Well, instead of having your tubes tied, maybe you have them removed. Or a hysterectomy, you have your tubes removed. or importantly, any abdominal surgery. So a hernia repair, gallbladder removal, that would be the time to have a conversation to say, should I also be doing this? It only adds on about 5 to 10 minutes, and the risks are really no worse than the regular risks with the surgery.
And now saying this, hopefully more women are going to be asking these types of questions. Now, the removal. Menopause, does that lead to menopause at all?
So it does not. So the ovaries, when you remove those, you end up in surgical menopause. And there are concerns there with increasing risk of cardiovascular disease, cognitive effects, and osteoporosis. But when you leave the ovaries in and just remove the tubes, you are not potentially causing early menopause. Now, we need longer-term studies to definitively prove that, but the short-term data says it does not affect timing of menopause, and it doesn't affect your ovarian quality, the eggs, the ovarian reserve. So really important to know. Go to outsmartovariancancer.org to learn more.
Okay,
really
this has really gotten your hair up the back of your neck.
It's just frustrating this has been out there and women don't know about it. They should at least have the option to make this decision, have a discussion with their doctor.
Amen to that. All right, Dr. Narula, thank you very much.